Hello ladies and gentlemen, I'm Dr. Marc Smith. This is Clyde, and we just did surgery on Clyde for bladder stones, and I want to give you a few tips on how you can prevent bladder stones as best as possible. But first, there's a couple of different types. One of them is called struvite. Struvite develops in the face of infection, so you have to have an infection to get a struvite stone, number one. Number two, calcium. Calcium stones are generally physiologically, genetically predetermined. Okay, number three is you get urate stones. They're rare. You don't see them very often. And number four is a silica stone, which is also kind of rare. You don't see it very often. So the big two are going to be struvite and calcium oxalate stones. Now, the best way to prevent either one of those stones is plenty of water. Lots of veterinary prescription diets are super saturated with salt. So what happens? You give the diet, dog goes over, drinks more water, drink, pees more, keeps that bladder flushed out. They also tend to have less vitamins and minerals. So more dilute urine prohibits or inhibits the concentration of those minerals to cause stones. So the basic premise is your pet's got to drink more water. One way to do that is offer more water. Another way to do that is facilitate more exercise and also give them more access to water. The more pets exercise, the more they need to drink to meet their basic physiologic needs. The third thing you can do, it might be a little bit controversial, but you can take a pinch of iodized salt every time you feed them, give a little bit of that on the food, and that salt will encourage them to drink more water. When they drink more water, what do? They pee more, they dilute their urine, they flush out bad stuff that gets there, and they inhibit the congregation of the vitamins and minerals in the food, which ultimately lead to stones.